Good afternoon. My name's John Carney. I'm the governor of the state of Delaware. I'm joined again today by the director of DEMA, the Delaware Emergency Management Agency, A.J. Schall, who's our point person in a response to the COVID-19 pandemic. We're here for a briefing, try to get some information out to the public about the situation here in Delaware. I'll start with that. Dr. Rattay, Karyl Rattay, who's the director of the Division of Public Health, she and her team are just doing amazing things through this whole pandemic, and we appreciate her and her staff. Before we get started, I do want to make a shout out and a big thank you to all the hospital workers. They're really on the front lines treating people who come in, some who are getting tested and are positive, others who are not but are treated in the hospital. They're doing a wonderful job. They're standing up our statewide testing program with 7 sites across the state. We're doing more tests than ever and thousands of tests over the course of the last several weeks. I think we're up to 7,000 or 8,000. We'll talk, Dr. Rattay will talk a little bit about that. AJ has some comments about our planning for the surge and alternative care sites, both here in Newcastle County and Kent and Sussex County as well. And I'll try to frame the issue in terms of the thinking and the data that drives our decision-making process. Kind of everything that we've tried to do here and the decisions that we've made have been with the objective of minimizing the health impact and the economic impact on Delawareans, saving lives and protecting people's health and safety. And so when you think about that, the major objective really is to limit the spread of the virus across our state, to protect mostly senior citizens who are most at risk. All the 15 deaths that we had are in that senior citizen category, and so we've redoubled our efforts, and Dr. Rattay will talk about that, to protect seniors in nursing homes. But it's really dependent on all of us to practice appropriate social distancing and hygiene in terms of washing hands, wiping down surfaces, and all of that. And so all of us have a role to play. As I've said hundreds of times before, everything that we do affects our neighbors, and everything that our neighbors do affects us. So let's take a look at the situation in Delaware as of yesterday. 783 positive cases. I understand we might be having some problems with the audio. So the situation in Delaware, just a brief overview. As of yesterday, 783 positive cases. Our first case, you'll remember, was back in March 11th. We've had 15 deaths, all of which have been in that at-risk population of senior citizens and those with most at-risk populations, those with pre-existing health conditions. We've actually had 71 recoveries, and those are people deemed not to be infected by the virus. Dr. Rattay might expand on that. And as of yesterday, 140 hospitalizations. As I say time and time again, we're always a day or two behind the actual number of positive cases because of the delay in getting testing results. We know what the hospitalization number is on a day-to-day basis. And so that positive case number today is going to be considerably higher than that. We haven't gotten the exact number, but it may be approaching 1,000 cases, which really just underscores what we've been saying for the last several days, and that is that we're getting to the point where we're seeing a surge and acceleration in cases, much like what happened a week or two or more ago in communities around us, New York, Metro New York City, across the line in Philadelphia, and even Baltimore, Washington. So 496 cases in Newcastle County, in Kent County 128, and in Sussex County 159 cases. So here's a little idea of the cases by age. You've heard us talk time and again about CDC's advice with respect to daycares. You can see that the infant to 4 years category, we've only had 3 cases We're concerned about every case, obviously, but this gives you an idea of the risk involved, ages 5 to 17, 12, and then that the age group that's most at risk from a life and death situation, other than those with pre-existing health conditions, are our senior citizens over 65, our moms and dads, grandmoms and granddads. And so the next slide is something that we really pay attention to. The graph, if you remember before, that we first inherited from FEMA showed a steeper graph there as the number of cases increased and the number of hospitalizations. You can see the bottom line is hospitalization, and that's the thing we focus on the most to drive all the activities in terms of surge capacity in the hospitals, the number of hospital beds that we have, ICU beds, staffing for those beds, ventilators. That's an actual number from yesterday, 140. We're going to have a higher number. There are a number, I think it was 136 in Christianic Care yesterday that we're waiting for test results. So that gives you some idea of what we might be looking at. And then as that infection, the number of positive cases increases, we'll expect a percentage of those hospitalizations to increase as well. Right now, for our planning perspective, I think the models we use are in the 20% range. 20% of the total positive cases might require hospitalization. So here are the actions that we've taken since March 11th. I won't talk about each of them, but the state of emergency that was declared on March the 12th, and then the amendments to that as we close down various parts of our economy and activity across our state, until our most recent amendment of yesterday, where we banned short-term rentals, getting a lot of feedback from the beach areas and other parts of our state about that, and creating problems bringing people from other states. We have a prior amendment that required travelers from other states to quarantine for 14 days, mainly to discourage people from doing that and putting themselves and others at risk, really a public health measure, and because we have a stay-at-home order here in our own state. So the message is stay safe, stay home. All restrictions are intended to flatten the curve, to protect our hospital capacity, and to protect those at most at risk of dying from the virus. So the next slide is over to Dr. Rattay. Again, let me just thank our team again, led by Dr. Rattay on the public health side, and Dr. Odom Walker, Secretary of Health and Social Services, and our DEMA team, and our local partners. An emergency response like this is implemented there at the local level. We have regular calls with the mayors in the towns and local governments across our state. We had one yesterday. We delivered some personal protective equipment to Newcastle County EMS and to the fire service through public health in our national stockpile yesterday. It's managed by the state, the government, and by this team here, and supported by our federal partners as well. So with that as an introduction, Dr. Karyl Rattay.
Thank you, Governor. I'd like to take a few moments to talk about testing. As Governor Carney said, we have wonderful hospitals here in our state who have stepped up over the last few weeks and have testing sites throughout the state, which has allowed many individuals across the state to have access to COVID-19 testing. At this point, we have somewhere around 9,000 tests that have come in, but many more that are pending. So many Delawareans have been able to get testing. Our public health laboratory also does testing. We prioritize those at highest risk, especially those who are hospitalized, chronically ill, those in long-term care or other residential settings, and of course, healthcare providers and first responders. You may have learned or heard that this past weekend, we received some rapid testing, some rapid test kits from Pinnacle Biolab, which is a Nashville-based company. We immediately began validation of these tests on Sunday. In fact, we tested our first group of first responders on Sunday. And we know there's some concern and confusion around the rapid testing, so we wanted to have an opportunity to talk a little bit about these rapid tests, what they do and what they can't do. The main purposes of this test is that it can allow us to identify if there's an outbreak in a setting, like a long-term care setting or another residential or congregate setting. So from a public health perspective, obviously that's really important to get rapid information back so that we can help the facilities in protecting their residents and staff as quickly as possible. There's also value in this test to be able to screen or test first responders or healthcare providers or others who have been exposed to COVID-19 7 to 10 days after their exposure. A test like this can help to determine if they are in fact infected and can help them get back into work sooner. These results come from a finger stick, and we get the results in about 5 to 15 minutes, which is extremely helpful. But what is really important for people to know is this isn't a test that's to test everybody out there in the general public. For those who don't have symptoms or those who might have been exposed yesterday to somebody who has coronavirus, this test is unlikely to come back positive. This test, if somebody tests positive, is going to very likely be a real positive, which really helps us in managing patients. But if it comes up as a negative, and this is really important, if it comes back as a negative, then clinicians and individuals need to take a lot of caution, because we know a negative on this test doesn't necessarily mean a person won't be negative a couple days later, or won't be positive a couple days later. So that's really important to keep in mind. We are expecting FDA approval for this test within the next few days. The federal government has given the states the ability to approve and validate these tests, which we are in the midst of, and we've already seen great value of being able to have access to quick results in some of our facilities already. As a reminder, though, testing really is intended for those with symptoms. So if you do have symptoms, we ask you to call your primary care provider, talk to them as to whether or not testing is appropriate for you. They can refer you to one of the testing sites. And if you don't have a primary care provider, call 211 and you can get connected to the appropriate help. I also want to talk a little bit about nursing homes or long-term care facilities. This is something we've talked about a fair amount. We are very concerned about our most vulnerable Delawareans who are in our long-term care settings. And so a number of measures have taken place. Our team has gone out to the long-term care settings and met with them and coached them on proper PPE and infection control. We feel it's incredibly important that a strong message about what is appropriate PPE or personal protective equipment is and how it should be used for all staff and all residents. It is one of the most important things that can be done to protect staff and residents. Additionally, we want to make sure that all long-term care facilities are fully aware of the expectation that if they have folks who have any symptoms of coronavirus, that they contact us immediately so we can help them get expedited testing. It's also important at this time that they begin to plan for isolation and proper care for individuals who have coronavirus. and also make sure that they're aware that there's an expectation that if they have a patient who leaves their facility to go to the hospital, that there is a right for that patient to return at some point back to that facility. So we look forward, our Division of Healthcare Quality and the State Health Operations Center, to continue to work with long-term care facilities and helping people be safe. Finally, I just want to make a very quick comment, again, to help people start thinking about safe holidays. It's coming up within maybe 1 day, 2 day, or within the next couple of weeks, depending on what you celebrate. And we want to make sure that people understand that families should not be gathering, and especially with the highest risk individuals in our state. Thank you.
Thank you, Dr. Rattay. This one working? This working? Try it again. All right, good afternoon. Thank you, Dr. Rattay. A few things we're going to cover today as before we go through some of the projection models, because I know that's what everybody's looking at is, where are we today, where are we going to be tomorrow and next week? We're watching that very closely. First of all, the Delaware National Guard has been an instrumental partner with us as we have worked through a number of planning processes. They're assisting us as we speak up at AI Nemours Hospital with the medical group that will be assigned there if we need to open that surge facility up. They are helping with some food missions as well, whether it's the food bank needing some assistance with delivering meals, in addition to some of the school districts that are going to need some help with dropping off to make sure the children have their 2 meals a day that they're provided by the school districts. So we can't thank them enough for what they're already doing and what we may call them upon in the upcoming weeks. We're watching the hospitals closely, as the governor said. However we flatten this curve, how it relates to the hospitals is very important. So if we could slow the rate of positive cases, we know that we will reduce the strain on the hospitals every day. So we are having calls 2 to 3 times a week with the hospital leadership, with the governor sits on, making sure we understand where they're at, what they are anticipating, and if there's any shortfalls. We are working with them to see how the state could assist them to decompress their hospitals when they get up to a capacity that they cannot manage. I'll talk about that a little bit on one of the other slides. And then as you might have seen, we had 2 press releases that went out in the last, one today, one yesterday, about alternate care sites. So we did this as a regional approach. We worked with the hospitals in the northern part of the state, St. Francis, Wilmington, Christiana Care, AI Nemours, and then down south we worked with Nanacook, BB, and Bay Health to really identify, what can they do collectively regionally, and then how would the state step in and assist them. And I will tell you, the partnership and collaboration they're doing amongst themselves is phenomenal. We are preparing for a number of scenarios, but they are definitely in line in helping each other very proactively. And then the community collaboration. We know that these are hard times for everybody, not only for the people that are struck with the illness or unfortunately the 15 families that have to deal with the death of a loved one right now, but also the loss of jobs or people being furloughed, the not knowing where your next meal come from. We can't say enough for them, the outpouring of support from community groups, whether it's your local church, whether it's the food bank, the Delaware Community Foundation has set up a COVID fund. I believe they're distributing several $100,000 a week to nonprofits that need assistance, primarily right now some of the food missions. United Way, Dr. Rattay talked about 211. Health and Social Services and Public Health worked with them and other departments of the state to make sure we had one number that we were putting out there for the public to call, because if they were calling to talk to a nurse, we want them getting to public health. If they were calling to talk to the Department of Labor, we wanted to make sure they got to the Department of Labor or Social Services, wherever. So great partnership that we've had with Donna Schneider-White over at the United Way and her group. So we expect that to be needed going forward. We know the community is the foundation of Delaware, a community of neighbors, as the governor always says, and I think we've seen the best of them, and I know there's more to come. So as I opened up with, we're watching the hospital capacity. We need to know kind of what the hospitals can manage, what their limiting factors are, and then what the state could do to assist. Governor mentioned 20%. So We are going by the assumption right now that 20% of the positive cases tested will need hospitalization. We're able to look a few days out. So right now, this chart that's up there now looks about 5 days out. We do 20%, we're looking 5 days out. It's like a weather forecast. The shorter term you look out, the more accurate it is. We need to make sure that we are erring on the high side of some of these numbers, hopefully, and not taking into account what the orders the governor put out almost 2.5 weeks ago now. We know about day 21, we'll see how effective those stay-at-home orders were. So if you look at it today, we have approximately 140 people in the hospital as of yesterday. We're expecting that to go up every day. If we look at that, the 20% at 4/12, so April 12th would be about 650 people in the hospitals. At that point, so 5 days from now, the hospitals would still be managing within their walls, with their staff, very comfortably, we'll put it that way, without implementing too many surge or decompression options. They've already canceled elective surgery. Their census right now, their occupancy at the hospitals is a little lower than normal, than the normal flu season we'd have seen last year. So we have that variance in our favor. We have these surge options, which not only are the outside facilities we are lining up or building, they are also the actions that the hospitals take, where they will use non-traditional methods sometimes, or rooms. So if there's an outpatient area that's not being used because non-elective surgeries have been canceled, they will use that location for a patient. So they have that flexibility in their wall. So for the next 5 to 7 days, I feel confident that the hospitals are able to adequately respond to the increased demand. I will tell you at the same time, we're also worried about the staff that's there. Everybody in the hospitals, from the people that run supplies up and down, to the nurses, to the doctors, are the heroes in everybody's books right now. They can't get enough of our thanks, and I think we should all express our gratitude to them whenever you can. But they are the ones that, if something happens to that staffing core, the nurses and the doctors, if a hospital gets a high rate of maybe positive COVID personnel, that's going to have a trickle-down effect, and that's when we're going to have to work as a community. And they've already talked about, what could Christiana do to maybe put patients from their facility over to St. Francis before we fill up new more. So the hospitals are, they're doing 80% of the lift here. We're just helping them make the partnerships and help them any way we can with supplies, National Guard, and some of these alternate sites.
AJ, if
Yes,
I
sir.
could just jump in there for a second. AJ talked about the math going forward and the assumption that we're using about 20% hospitalizations. You can go back and do the math for the actual numbers prior to this, and the trend has been less than 20%. So we're using an assumption that is a little bit on the conservative side relative to what we've seen in the past. Having said that, there are other parts of the country, like New York, that have had a higher rate of hospitalizations. And so just to point out that point there in terms of the assumption that we're making in this predictive model.
So this is something we look at almost every day, because it's helping us identify when we have to pull some of the levers for those downstream effects. We are working closely with the healthcare community overall. As I said, we're doing weekly, at least 2 calls a week with them. And I was honest with them the other day. I said, I hope we, put beds in parts of our building we've never needed them. I hope we build a mobile hospital and we never have to put one person in there, because that's good for Delaware, but neither I want to not have it ready when we need it. So continue to work with the hospitals very closely. I want to say the data we're getting from them every day is being worked in trying to make this as real-time model. And when we say model, we're using, about 25% growth rate of cases day over day, 20% of the hospitalization. We don't have the historical, foundation to say we know what it's going to be or when that's going to potentially end because of the stay-at-home models. But to get a little bit more into the weeds about the alternative care sites, or the ACSs, Newcastle kind of has a 3-pronged approach. First prong is the hospitals are going to do everything they can within their walls. They want to be as self-sufficient as possible. Nemours, so Alfred A.I. DuPont Hospital for Children, was gracious enough last week, as we briefed on, to open up a few different areas in their building. I will tell you, last week, Dr. Greenspan and Pauline and other members at the team up there, Mark, did a remarkable job to get beds there, the IT equipment that's there, make sure they know how the processes are going to work. The National Guard's up there today kind of orientating, understand the process and procedures for if and when that needs to be turned on. And that will be turned on as a collective decision between the state and also the healthcare system when they kind of reach that point where they're saying, hey, in 48 hours or in 2-3 days, we're going to probably need some help and get some people out of here. And that's a moving target. We can't tell you exactly when that's going to be, but it is something we're in constant communication of them as well. Also, something that we mentioned about 2 weeks ago, and I think it came back as an option that we needed. Dr. Rattay talked about the long-term care facilities in the nursing homes with the Governor Bacon Health Center as a needed facility. So starting today and I believe tomorrow, some residents that are not positive for COVID, that have not been, have not at risk of having COVID, are being moved down to Smyrna to allow us that flexibility in Bacon to move people maybe out of the healthcare system that can't go back to a nursing home for one of many reasons. It could be the nursing homes don't have the staff to take care of them. The nursing homes might want a test before they are able to go there. But what could we do knowing that they might not need the full wraparound services of a hospital, but they might need some medical personnel to give that there. Again, we are not planning on moving anybody there in the short term. After everybody gets moved, the building's going to be cleaned and prepped and ready. Again, another tool we have in our toolbox to be able to turn on if and when we need it. So then we look at Kent and Sussex County. Again, the hospitals are, they're good with how they are positioned today, and they're looking at what they could do across the 3 providers down there, Bay Health, BB, and Nanticoke, on how to possibly move patients or decompress within their own system. We've offered a mobile hospital that the state has that could house up to 50 to 60 people. We've identified areas to tie it into their existing hospitals on campuses. So I know last week we briefed out about Milford Memorial Hospital, about possibly turning that on. After talking to the leadership of the hospitals in Kent and Sussex County, having something that has the services right across the street is a lot better than right down the road. So we have that function available. We're ready to deploy it. We have a common operating or a ConOps plan with them to say what triggers are we looking at to push it down there and where, because we want them to tell us where it's going to be the most impactful, where they have those nurses, doctors, and that staff to help it, and then we're going to support it with the National Guard, Medical Reserve Corps, or however else we need to lean on our partners to do so. So again, I think that bottom line says it the most. It's a collaborative effort. Everybody wants Delaware to succeed. Everybody wants our hospital and our healthcare providers to succeed, as they've already shown across the country in New Jersey and New York, Florida, Michigan, and other places that have already had some of these hot spots. And we want to make sure Delaware learns everything we can from talking to our partners that have already kind of gone up to that steep curve of the spike. So I'm proud to be working with the hospitals. I can tell you they have led the way, and they've come up with a lot of great ideas. And again, we'll be ready, and we're evaluating this every day, looking at the positive cases. We do expect those cases to go up as public health does more testing, and we'll continue to look at our plans and make sure they're ready to go as needed. So, Governor?
So thank you, Director Schall. Thanks for your great work, particularly the partnership with the hospitals and the collaboration that goes on a day-to-day basis, really focusing on these alternative care sites. And you probably mentioned it, but the idea there is to move patients who are not COVID-19 positive out of hospitals to free up space within the hospitals to be able to provide that critical care that they need, and not so much to move COVID-19 positive patients into those facilities. So that work is really coming together as we look at the predictive model, and that's why we follow it on a day-to-day basis and try to get the best numbers we can, is to have some idea about when we're going to stand up one of those sites. And I know you're in constant communication with the hospitals, and they'll help us make that decision, and it affects them at a very granular level, because they're going to provide most of the staffing for all of that. Absolutely. And the equipment, and that's why the alternatives have really emerged that facilities closer to those buildings, closer to those physical facilities, will work the best. You know, if you look back at the model, if somebody could put the graph, the objective of all these things that we've been doing in the declaration of the state of emergency is to reduce the community spread, to reduce the spread of the virus in the community, so as to preserve the critical hospital treatment capacity that's necessary for the sickest patients. And so that hospitalization number we look at every day, try to predict where it's going to go in the days ahead. And as we've been saying for the last several days, the next 2 weeks and maybe a little beyond we're really going to be critical for here in our state. We're going to see the number of positive cases continuing to trend up in a way that's going to look frightening, I think, to all of us, and very concerning. We're going to see the number of those hospitalization numbers go up as well, and we're preparing for that so that every patient that enters a hospital in Delaware can be treated and be safe. So here, we're in this together. You know, we've been saying this all along. We have a stay-at-home policy or order in our state. Practice basic hygiene. Wash your hands and wipe down surfaces that are touched often. And think about your neighbors. You know, what you do affects your neighbors, and what your neighbors do affects you. And if we're all able to do these things, and the effectiveness, our effectiveness in doing these things will help save lives in the long term, and that's what it's all geared to do. So I, again, want to thank all our first responders, all our public health workers, all of AJ's team, and the local fire departments and ambulance services and the rest. You know, as we were over at the Newcastle County EMS the other day, the chief there was commenting on how quiet it was because there's so much decompression that's been happening in the hospitals, moving patients out, freeing up space for the surge that we expect to be there. And so we continue to be vigilant about being ready, to be guided by the science, and to ask all Delawareans to pitch in and do their part. So with that, I think we have questions, or we'll go right to the questions from people in the room, and then we've gotten some questions online that somebody will forward our way. So any questions from the media in the room? Please go ahead. I think I've got a microphone. There you go.
All right, Governor, I've got quite a bit, actually, from colleagues.
Could you just say your name and your...
Esteban Parra with the News Journal. So, one question that was asked, or I was asked to ask, is the mask. How do you, or what is your recommendation for wearing a mask? One governor says wear it all the time when you're outside. Others say just when you're around people or in close proximity. What is your answer to that?
Yeah, so when the CDC kind of changed its advice over that, around that, and I'll ask Dr. Rattay as well to comment, you know, we kind of changed our advice on it as well when we're developing a public guidance. What CDC has said that wearing a cloth mask like that will help not so much protect the person wearing the mask, but protect others around them to catch that respiratory particles that are released when you breathe, spit, or sneeze, that kind of thing. And so it's been recommended as an extra measure to help protect the spread. But you got to be careful with it, right? And that's why we're kind of fine-tuning the guidance. It's not for everybody. It's not for, you know, workers it's really for people going out when they go to the grocery store. A little tough to do all the social distancing as appropriate, right? 6 feet away and that type of thing. And it's not necessarily recommended for use in all circumstances, particularly certain work circumstances don't require it. And so we're working on the nuance there. We also don't want people to get the impression that they should go out and get an N95 mask because they're in short supply, right, for first responders and healthcare providers. Now, having said that, we think there's a positive that can be gained from that for people using it to when they go out to the grocery store. It should also not be a replacement for the guidance on social distancing, on a proper hygiene. So we're working on that messaging. Dr. Rattay?
Thank you, Governor. Not much to add other than, I mean, we've been learning all along about this virus, and asymptomatic spread, we're learning, is more common than we initially believed was the case. So it certainly makes sense that people without symptoms could be, by talking, could be sharing or spreading the virus. So use of cloth masks can certainly help with that. But as Governor Carney just said, we also want to make sure people know that wearing masks is not a substitute for appropriate social distancing and hand hygiene, as those are incredibly important.
I get that, but I mean, the question is, I guess, that I still have is should they be wearing them all the time when they're out there? I understand if they're working, they don't have to, but I mean, if they're at the grocery store, if they're out there outside walking their dog or whatever in a park, should they be wearing them, or is there any guidance from the state yet on that?
I would say a general guidance, which we believe to very much be true. If it's difficult to social distance, if there are settings in which it is difficult to stay 6 feet away from people, especially indoor settings. Outdoor settings, you don't get as much spread, but indoor settings, if it's difficult to stay 6 feet away from an individual, like, as the governor said, the grocery store, then it certainly makes sense to use a cloth mask to prevent spreading the infection to others.
Another reporter, how did you, and this is the governor or whoever, but how did you come to your decision to issue the stay-at-home order and subsequent updates until May 15? Other neighboring states are saying different, and I guess Pennsylvania is saying April 30th.
Yeah, I think we reacted to the situation on the ground in terms of the number of positive cases. We did react in part to the gatherings that we were seeing out in the public. I mean, that is really what pushed the issue with respect to closing beaches and bars and restaurants. And we did pay attention to what was happening over the line in Pennsylvania and Maryland and over the bridge in New Jersey as well. So in the long term, our effectiveness in flattening that curve, we'll see, did we do it soon enough? Was it effective enough? Did people practice appropriate behaviors enough, as we see these cases arise, positive cases and hospitalizations? Other questions?
Was there a strategy to what you closed down and when, or is it just based on, anecdotal evidence coming in? And what would be next? I mean, we've heard golf courses, people are behaving at golf courses, some people are crowding in. Like, why pawn shops? Why electronic stores that had been, by all accounts, doing service at the door and things like that? Was it a strategy, or is it something that, you can reevaluate? And is there anything that you're considering sort of reopening because you think you could?
Well, first of all of this is uncharted waters, right? And so we were reacting and making decisions based on recommendations from the experts, the public health experts. I don't know that I knew much about social distancing before a month ago, but I've learned a lot about its importance in a pandemic spread like this, and in particular, its connection to the health safety of all our residents, right? And so once that became clear, it was somewhat obvious as to the actions that we had to take. When I traveled to Sussex County on that beautiful spring day and saw all the people out on the beaches, I mean, I knew what we had to do. And got similar feedback on the Saturday night before that, just before St. Patrick's Day, when bars and restaurants would have been full, that we needed to do something. So it's a combination of the science from the experts and recommendations from public health officials and CDC, balancing that out with the resistance of businesses and members of the public, and just figuring out when to make that call. And we did it based on the guidance that we received and the situation on the ground. Going forward, I think what we can lean into more than anything is the enforcement side of it. Because it's one thing to have a stay-at-home order, but if people aren't following it, they're going out and doing things that they shouldn't. They're permitted to go out for essential activities, grocery store, doctor's offices, a walk in the park by themselves or with one other person, social distancing, all of that. If they're following that, that's one thing. If they're not, and we've got a lot of reconnaissance out there, I think some of our law enforcement actions on the border have sent a message that's sinking in and having a positive impact. So we'll follow the guidance that we know is out there and make decisions based on the situation on the ground.
Amy Cherry from WDEL asks, are you satisfied with the enforcement of your state of emergency thus far? And what would it take for you to raise the level to begin citing out-of-staters, for example?
Well, the whole enforcement side has been driven by recommendations from our Attorney General. Law enforcement is in her bailiwick, if you will, providing advice and guidance to Delaware State Police and local law enforcement. And they have determined the approach that we've taken with respect to the roadblocks, the approaching the cars, the questioning in a thoughtful but serious way, and ultimately to the issuing of citations and tickets. And I think there's been an arrest or two. I'm not sure it's been by Delaware State Police, but the guidance has come from the Attorney General on that. And we have measured our action based on businesses that were determined to be essential, but they've just not been able to enforce the appropriate behaviors and social distancing. I know as I go out to some of the big box stores, 2 weeks ago I went into one and it was a disaster. Today I go out, the other day I went out to the Home Depot up there in Northtown Plaza. Everybody was neatly in row, lining up 6 foot apart, and they had more demarcations inside the store, just as we had required with our executive order amendment or our declaration amendment.
Laura Walter at Coastal Point says that we're based in Sussex County. We're hearing about people who were ill this month with very telltale symptoms. However, they're testing negative for COVID-19. Can you speak about some of the other types of flu, colds, and bronchial diseases that are making the rounds right now and how that's affecting things?
That's a great question. So one thing I do want to bring up that does come back to the testing comments is it is important that people are tested at the right time. In other words, when they have symptoms. If people are tested before symptoms, they're more likely to have a false negative test result. So I just want people to keep that in mind. But there are a number of viruses circulating right now. The common cold is actually a coronavirus, which is certainly circulating, but we're also still seeing some influenza, which thank goodness has decreased a lot, but it's still out there. RSV is another virus that's out there, and then many Delawareans suffer from allergies, which also can give certainly shortness of breath and cough to many individuals. So, I know it can be confusing and concerning to people to have these symptoms. So if you have any question, best to talk to your doctor.
So to that point, we've had 6,800 negative tests. And those were people that were tested that were presumably symptomatic, because that's the protocol for doing the tests in the first instance.
So Esteban Parra here again with the News Journal. You were mentioning, or you brought up, I guess, police going out there to the borders and whatnot. What about Delawareans who are leaving to go to stores in neighboring states and returning? Why have they not been targeted?
I'm not sure they would be implicated under the ban. The quarantine is for non-Delawareans traveling into Delaware for non-essential work. They're permitted to come in to work at an essential business and leave and go home. The example you gave is a Delawarean now who went into Pennsylvania. He or she would be violating the order if they weren't doing an essential activity.
So your order, the Delaware's order says you can't come into Delaware to buy food from Pennsylvania, New Jersey, or Maryland, or any other state, I guess, for that matter.
Right, that's because they have those essential facilities there in
Then
Pennsylvania.
why are but Delawareans are allowed to leave the state to go purchase food elsewhere? I mean, I've seen them at the Walmart in Elkton. I see them at the Whole Foods in Glen Mills, Pennsylvania. I mean, that's the same. Isn't it kind of spreading the spreading or bringing in the virus or a chance of
that would not be captured in either of those orders. Certainly, Governor Wolf could create the same kind of order on the other side of the line.
Okay.
But our quarantine requirement is for non-Delawareans coming into Delaware.
Susan Canfora at Coastal Point newspaper asks, how do the number of coronavirus cases in Delaware compare to other U.S. states? Higher, lower? Any insight into why that might be?
Well,
So I don't have the numbers in front of me, but, very often what we'll do is we'll look at a percentage of population and kind of see where we are versus Pennsylvania, Maryland, New Jersey, and specifically New York. And, we knew we were trending a little bit behind them. We have not looked at those numbers in depth as we feel like we have some good trends that we need to monitor here to prepare rather than compare us. I think what we are looking at is at the 21-day mark, which will be next Monday, of the stay-at-home order, to see, we would expect to see some gradual improvement on the testing after that and show the effectiveness that it had. So,
I did see some numbers and some rankings now that I thought about it. In the White House call yesterday, I guess it was, prior to the call, we received a series of graphs from FEMA that showed the situation in each of the states. All the governors from the states and the territories were on the call. And they identified the states with the biggest challenges: New York, New Jersey, Florida, California, and a few others, mostly major metropolitan areas. So in our region, Baltimore, Washington, Greater Philadelphia, the New York City metro area were ones that were identified. When they did the state, and so those really hard-hit metro areas were kind of way off the chart. And then all the other graphs were kind of grouped up. We were in that next bunch. I want to say number 14-ish. But again, it was hard to determine whether they had their own projected numbers or where they were using the actual numbers that we have in our state. My guess is that they use some actual numbers and then use their own assumptions about hospitalization rate up from there. And then, by the way, there's a whole series of states in rural America which don't have high rates as a percentage of their populations. And so if you look, it's really concentrated in the large population metros across the country.
All right, this will be the last question, and it comes from Tom Lehman at WBOC. He said, we've gotten at least one report of people who are Delaware residents that are being left temporarily homeless because of the hotel closure that was instituted effective tonight due to extenuating circumstances. What should they do when a hotel they booked for a month decides to shut down?
So that shouldn't happen. We have permitted hotels that provide those services to stay open for that. We also have a team that's working on the homeless issue, and they've been identifying just the opposite. They've been identifying hotels so that the homeless have places to go, and we're hearing back from various communities that is occurring. So the situation that you described, or that Tom Lehman described, shouldn't be happening under our order. Maybe it's an individual who we need to reach out to make sure he or she has the accommodation that we're making out there for folks. Dr. Rattay, anything you want to add to that?
I suggest calling 211.
So have Tom or whoever he heard from call 211 and take it from there. So I'm giving the wrap-up signal. So again, I want to close by thanking all of the workers at Public Health. I also want to thank state employees and county and town employees who are working through this emergency declaration. We have a number of those folks in the room. We appreciate your patience and the service that you provide to the people of our state. We are providing service to Delawareans through state government with more than half our workforce working remotely. Obviously, we have a lot of employees who are emergency type personnel in our prisons and juvenile detention centers, law enforcement, public health that are out there on the front lines, and we appreciate their great work. Thank you to all our partners, particularly the hospitals, and lastly, just to say that our success in protecting Delawareans from the virus depends on each and every one of us. We all have a role because we all can either abide by the emergency orders and exhibit appropriate behavior in public, social distancing when you're out at the park. We'll have some advice and guidance coming for the cloth masks, being cognizant of your elderly neighbors and relatives to make sure that they're doing well, and thinking about your neighbors as well as yourself. So thank you very much, and we'll talk to you soon.